welcome to the Gloria Effect, where real discussions meet real life situations. Today we are looking at a very important topic, peri-menopause. This is a stage where women experience emotional, psychological, physical, and hormonal changes. A lot of times women are not ready for these changes. Don't think you're going crazy. You are not alone in this. I brought in a doctor who will be talking to us on this topic, on how to recognize the symptoms, the management, and how to navigate this stage beautifully. Here with me, I have Dr. Nkechi Akinwale. Welcome, doctor.
Nice to meet you, Gloria.
Nice to meet you too. It's a privilege to have you because of how important this topic is. I have really seen a couple of women who were vibrant, who were strong, really lose themselves as a result of this stage in life. So it's a privilege to really have you here to discuss this with us. So, doctor, what exactly is peri-menopause?
All right. It's nice to be here, like she said. I'm very glad. Peri-menopause, like you said, is that season just before menopause. So I'll define menopause so that you will know when the season occurs. So for menopause, it's the season when there's cessation of menstruation for up to 12 months. Meaning, if a woman saw her period 6 months ago, she has not attained menopause. So that's the stage of peri-menopause. The stage of peri-menopause is when the periods become irregular, and it's like the body is building up to enter menopause. Like it's the stage leading up to menopause. So it's just some years before menopause.
Okay. So menopause, peri-menopause, menopause, and post-menopause. What are the differences?
Okay, so it's just like asking me what is before, during, and after.
Yeah.
So that's
because I know that there will be symptoms that will differentiate these stages. That is why I'm asking this question.
Okay, so for the period, for the menstrual cycle period, we know what happens, right?
Yeah.
Like each month, a woman bleeds, So the peri-menopause is that season when periods become irregular. For some people, early 40s. For some people, it starts late 30s, early 40s. And some again don't even have symptoms. It just
Shows up.
menopause just happens suddenly. And because menopause can happen even medically, for some people they don't experience this season we're talking about. So it differs with different human beings. So like we said, perimenopause will
They don't experience the season of periods?
They don't experience a gradual shift into menopause.
Okay.
Because sometimes it's medical.
Okay.
If your womb is taken out because you have a condition, maybe you gave birth and you had uterine rupture, had to take out the womb, that's menopause. So you don't even have the season at all. You just go straight into menopause. So that's what I'm trying to say, that some people don't even experience perimenopause. They go straight to menopause, which I've defined menopause. Then post-menopause is the new life. After you've attained the position and said, okay, now I'm post 12 months period, and then I've started living this life without period. Post-menopause.
Wow. This is amazing. So what are the most common symptoms at this stage?
All right. So for the woman, wow, the woman's body is just dynamic, and I'm glad I'm a woman. I'm glad because it's dynamic. There are hormonal changes which is the most important, right? During menstruation, the two most common hormones are estrogen and progesterone. So at this point, estrogen is getting lower, progesterone is getting lower. So because there's another hormone in the brain called serotonin, and those ones are they're the hormones affected during depression. So and there's a relationship between estrogen and serotonin. So when estrogen is going down, sometimes it causes that to come up, and you know there is now what we call depression, mood swings. Then we also have hot flushes. So it's somehow like I said before, it's an introductory period into menopause. So you are sometimes having the symptoms of menopause, but not all the time. Menopause is total. But in peri-menopause, it comes and goes. Sometimes you just see that, oh, I didn't really see my period this month, it's light. Sometimes again, you're just upset, you're just annoyed
For no reason.
for no reason. and and then sometimes you have these hot flushes. By hot flushes, I mean you just feel hotter than normal, like I'm sweating. Oh, and you're like, what is going on? Some people get so worried, they come to the hospital. Nothing is going on. Just check your age, check your menstrual cycle. Nothing is going on. You're not sick. You're not. It's
You're
not
not
a
going
disease.
out of your mind.
Yeah.
And you are not possessed.
It's not possessed. It's not a disease.
Yeah.
It's natural. It's just the same way. I think we need to have stuff like this more, because you know when a girl is about to start her period, there's always that education. People are telling you, oh, you are not about to stop. Nobody is telling you.
Nobody is saying
Nobody is
anything
telling
about
you
it.
why.
Yeah.
And you should prepare people. Like I've spoken about depression. I've spoken about hot flushes. I'm going to speak about vaginal dryness. So what happens there is that the cervical mucus are no more producing the way they used to produce before.
Yeah.
So for a woman, you say, oh, okay, so what's that? It's okay now. It's not okay, because you will have pain during sex, what we call dyspareunia, and then the men will now start getting angry. What's wrong with you? That alone can cause depression now. When you don't know why suddenly you will start having pain during sex, and then your husband is upset. It's just natural. It's what is happening in your body. It's not your fault. It's not, you did not do anything wrong. You don't have a vaginal disease, which is the next question. You know, people will now say, oh, maybe I should check whether I'm itching or something. No, I'm not itching. It's just, and yeah, like you said, there are remedies. I'm sure we'll get to that sometime in the course.
So why do hormonal changes affect moods, sleep, and mental clarity during peri-menopause?
So these hormones, they send messages to the brain. Their hormones are like liquid, or how I put it, messengers. So when they are much, depending on which hormone we're talking about, it's sending messages to the brain. So definitely, if there's a hormonal imbalance, for instance, in a woman, it will affect your mood. It will affect. It's a natural thing. It's not an odd thing. Why is that God made these hormones to affect our moods?
Yeah, like,
so
is it like a stabilizer?
You could
so
say
if it
that.
is affected, something goes down within you.
That's right. Most of the time we feel down once the estrogen levels are down. And so now you are forcing me to go into remedies, so let me just I will go, since you are taking me.
Please go ahead.
So, because when people now come in with extreme symptoms, very extreme, you have to intervene, and that's what we call HRT, hormonal replacement therapy. So we look at you and we're saying that, oh, you're having dryness, it's affecting you. Put you on hormonal replacement therapy. And these hormones are the hormones that have stopped producing in the brain before. We're talking of estrogen, we're talking of progesterone. So we place you on it, and then it restores your Period, in short. That's the summary. It just normalizes you, and then you calm down and become okay. Now the question is it everyone that will be placed on hormonal replacement therapy? Because every woman will experience menopause. The answer is no. Yes, because it's not everybody that will react in the same way. For instance, let's talk about dysmenorrhea. You know, not every woman has dysmenorrhea, but does every woman experience menstruation? Yes. So you intervene for the one with dysmenorrhea, and then for the one that are just okay, you leave them. So that's how it is. But for the vaginal dryness, however, we have lubricants. You can even, just enter the pharmacy and say, okay, this was going on, I need a lubricant, and you use it, and at least that part is solved. So we look at different aspects of the changes you're experiencing and treat different aspects.
So, while you're talking, I kind of got thinking. So, if you intervene with medication and this period is restored, is it to delay the evil day? Or this is a permanent solution?
Well,
Because I'm looking at, this is a stage before menopause. Is it, are you like taking care of it, that okay, if menopause supposed to begin at 50 and this person is placed on this medication at 45, now does this settle that issue, and at 50 everything goes normal?
no.
I needed to actually know.
Yeah, the answer is no. Because obviously this person has some issues. So the person has some issues entering into menopause. It's not a smooth transition. And even during menopause, in short, if you had issues entering, tell me how during the menopause you're going to enjoy them. So it's something that the person will have to keep taking the medications, and then will arrange visits, medical visits for that person. I would like to say that it should be a multidisciplinary approach. By that I mean it's not just one kind of doctor seeing the patient. A gynecologist should see, but I also think a psychiatrist should see too, because you need to bring the person out of depression sometimes. I think a lot of other disciplines in the hospital should see the patient. So the patient should, when you say the patient should come back, it's not like we're saying every month you'll be coming. They will arrange it in such a way that it's really not cumbersome, it's not stressful. Sometimes it can be once a year, sometimes once in 6 months. So the patient can live a near to normal life. Yeah.
That's so good. At least there's hope.
There is hope. There is surely hope. And I want to say to every woman, please don't be afraid. It's not a weird experience, and it's not something that you've not experienced before. The menstruation stuff for me is even more scary than menopause. I'm serious. Because for me, I don't know about other women, but to me, menopause is going to be a relief. Like, okay, you're not going to buy pad again. You're not going. Sometimes the whole thing can be so annoying. But then everything stops, and like, oh, I even think women should look forward to it, not get scared. That's my take.
Yeah, but apart from using pads, there's the changes that surround it is actually the challenge. And this actually brings me to my next question. How does peri-menopause affect sex drive and intimacy?
So just like we said before, there's going to be dryness, vaginal dryness. So definitely it reduces libido. Makes one not as active sexually as before. So definitely it does affect. But it's not, like I said before, I'm trying to allay people's fears by saying that it's not all the time you see all these symptoms. By the way, have you Googled symptoms of malaria before?
No, I have not.
This because when you Google it, you say, this is a very deadly disease. If I get it now, I am dead tomorrow. My liver, my kidneys. You understand?
Yeah.
So all these symptoms don't have to come upon you just because you are going through. Do you understand?
I get
It's
you.
not something that, okay, she said hot flushes. Today I will have hot flush. Tomorrow, dryness. Next tomorrow, depression. Hey! No, it's not like that. So you are not going to, you may not experience all these symptoms. And sometimes these symptoms don't even start till after the thing has totally stopped. Although there's also, apart from depression, there's anxiety too. Those people that are like apprehensive. Hey God, so I'm not going to have a child again. Oh God. So this is, there are all sorts of things associated with this period of time in a woman's life. But let's not be scared. If you're a woman that has gone through menstruation, please don't be scared. Don't be scared. Yeah.
So you were trying to point out the effect on intimacy and sex.
Yeah. It reduces your sex drive, your libido, and decreases the enjoyment. How I like it. Increases the enjoyment. Yeah. That's what it does.
When should a woman consider hormone therapy?
Okay, when when all the mood changes, the depression or whatever you're going through, it's affecting the quality of your life. Quality of life. Quality of life, I mean, you're not able to carry out your daily chores. You're not able to do what you normally do without those symptoms affecting you. You're not able to even make a living or live one whole day without it disturbing you. You should see a doctor. You should talk about it to a doctor. And trust me, people know when to go to the doctor. When you are sick, nobody tells you.
Yeah.
You will run.
Yeah.
So
that's true. So how does peri-menopause affect long-term health?
That's a tricky question. Okay, let me take it from this way. Let's talk about low levels of estrogen. So they also affect the bones and makes the bone more brittle. So it could cause easy fractures. So you notice that women are more frail the older they get, and then they need to be more careful because when they fall, they develop fractures. Before they heal, you could start hearing arthritis and all sorts of things just because the estrogen levels have gone low. Now, if those things happened when the person was still menstruating, it might be fine, but just one small fall, and then we're talking about so many complications. So yes, if not taken seriously, can affect health in the long run.
This question is particularly important, right? How can a partner or a husband help his wife at this phase?
So now, men, this segment is specifically to you. So you need to be very supportive at this stage. It's just like a woman going for labor. You know how the husband goes with her, and you know how he takes care of her. That's exactly how it is. So you just be as nice as possible. Don't start saying, you too, madam. Why is this? You understand? Please have mercy on us.
Honestly.
At this stage, the woman still needs pampering. She still needs to be loved. And then sometimes you should be the one to go and get the lubricant. Like I said, I went to a pharmacy one day, and when I saw an old man walking, I had what was buying. I said, correct, Baba?
Yeah.
He's a correct man, because how many people they will be like, I beg, it's your problem, take care of it, But he knows that this woman is not enjoying this thing without, you understand? Yeah. So try to be helpful, try to talk her through it. When she's crying, try to be that shoulder that she can, make her know that no, this is nothing, it's not stressful, it's not, you understand. So just be there, right? Please support us, and thank you.
Doctor, thank you so much. Thank you so much. I don't know how to thank you, right? This weight is off my shoulder right now. It's so amazing how you broke down everything to feel so like it is possible to just go through the phase gracefully, It's just so amazing because I saw a vibrant woman basically calm down and become a shadow of herself as a result of this. I am not sure of the kind of care she looked out for at this particular time, but I know she became deeply depressed, even in the middle of a discussion that had nothing to do with her. She could break down and cry.
So I think your friend should see a psychiatrist and also a gynecologist because she actually needs help. She's at that stage where she needs an intervention. Yeah, she should.
All right. So, doctor, once again, thank you so very much. And I would beg you in advance that we will be inviting you again for another topic. Please don't tell us no.
Okay. It was so much fun being there, so I like to be back. Yeah.
So
I like to be back.
Thank you so very much.
Thank you.
So this has been the much we can take today. Dear woman, whatever the challenges you are facing at this stage, look for help because you are not alone. You can navigate this stage gracefully, and we are all here rooting for you. Thank you. Goodbye.